In this session, we'll be talking about cataract. So, look here. Look at this picture. You see this lens here, don't you? Yes, you can see the lens here. About a lens, normally it is transparent structure, but if this transparency is lost, if the lens becomes opaque, then this leads to a condition called as cataract. Now what happens if the lens become opaque? Why are we worried? See, it should be a transparent structure, the lens. Only then it can do refraction, right? Bending of the light rays and form a perfect image on the retina. Now if lens is damaged, the vision is going to be affected, right? Okay. Now there are different kinds of cataract. We'll be learning about those. So what is the definition? Loss of transparency of crystalline lens. Starting with congenital cataract, see, it is an autosomal dominant condition associated with certain syndromes like Down syndrome, Edwards syndrome. Okay, 3 points about Edwards syndrome, guys. It's important. See, Edwards syndrome, it is what? It is trisomy 18, right? What is the risk factor? That is increased maternal age is the risk factor. Now, so that's about Edwards syndrome. Now, what are the other points you should remember? What are the features of a child who is having Edwards syndrome? They will have a prominent occiput, okay? They'll have a prominent, say this is the head, they will have a prominent occiput. They will have a rocker bottom feet, right? Rocker bottom feet. They'll have intellectual disability and the ears will be malformed, low set. Okay, that is Edwards syndrome. Okay, that's all you have to remember about Edwards syndrome. Now, congenital cataract, it is associated with metabolic disorders like hypoparathyroidism, hypoglycemia, galactosemia, Fabry's disease. What is Fabry's disease? See guys, 2 points about Fabry's disease. First thing you should know that it is X-linked recessive disorder. First point, X-linked recessive disorder. And here what happens is, so in Fabry's disease, remember guys, the body is missing one enzyme called as alpha galactosidase A. Repeat after me. What is the enzyme that is missing in the body here? Alpha galactosidase A. Now, because of this enzyme that is missing, a fatty substance called as, because of this enzyme that is missing, a fatty substance called as globotriosylceramide that gets built up in the blood vessels, in the skin, in the nerves, in the kidneys, in the heart. Now this is very abnormal. See, when this material gets built up in the skin, it can cause small dark spots on the skin called as angiokeratomas. Now when it gets built up on the nerves, it can cause burning pain in the hands and feet. Now when it gets filled up in the kidneys, it can cause gradual damage and lead to kidney failure. Now when this material gets deposited in the heart or the brain, it can lead to heart disease and stroke even at a young age. Okay, so without treatment, the patient can go for kidney failure, heart problems, stroke. So with treatment, that is, you can give an enzyme replacement therapy, we can slow down the disease. Understood? So that is what you should know about Fabry's disease. Also, congenital cataract is associated with torch infections and malnutrition of the mother. When the mother is pregnant, if she is not having enough good food, then also the child can have congenital cataract. Okay. Now, guys, look here. The question they ask you here is, most common type of congenital cataract, what is it? It is something called as, see, blue is not visible here. It is called as, important question, blue dot cataract. See, congenital cataract means it is present from birth. That too, you guys know. Okay, blue dot cataract, that is the most common type of congenital cataract. ഇവിടെ ലെൻസിൽ what happens to the lens, there will be bluish white opacities like dot like spots that can be seen when we examine the lens. So that is blue dot cataract and this is how it looks. Usually the asymptomatic, it does not affect the vision if it is mild. Sometimes ഇത് incidentally നമ്മൾ ഡിറ്റക്ട് ചെയ്യുന്ന കാര്യമാണ്. Alright, so if vision is not affected, no treatment is needed. But if it is dense, okay, if it impairs the sight, then yes, you have to go for treatment. So remember, this is a question they ask you. Most common type of congenital cataract, it is blue dot cataract. Moving on. If the question is most common congenital cataract associated with decreased vision, then your answer should be lamellar cataract, or the other name for lamellar cataract is zonular cataract. Now look here, what is lamellar cataract? See, lamellar means it is a layer or a zone of the lens. It's not the whole lens, but the layer of the lens that is getting affected. Okay, so it's like, the opacity is like a ring or a disc within the lens. Okay, but there'll be clear areas also. Just a layer of the lens is affected. So that is called as what, guys? Lamellar cataract. Now this lamellar cataract, it can cause vision impairment. So it has to be treated at the earliest. Now this is another MCQ, very important. Now other types of congenital cataract, just go through the names. They don't usually ask much about the other types, but just go through the names. Anterior polar cataract, posterior polar cataract, sutural cataract, and total congenital cataract. So when the opacity, see, it's simple, guys. When the opacity, look here, this is the anterior part of the lens, right? So when the opacity, it is in the anterior part of the lens, that is called as anterior polar cataract. It is the anterior pole of the lens. So it is called as anterior polar cataract. And when the opacity is not behind the lens, like at the posterior pole here, then we call it as posterior polar cataract. See, in sutural cataract, the opacity occurs along നമ്മുടെ ലെൻസിൻ്റെ അകത്ത് എന്തുണ്ട്? See, the inside of the lens, that is called as nucleus. അപ്പം nucleus of the lens has got different parts. We have a part called as fetal nucleus. ലെൻസിൻ്റെ അകത്ത് we have got the nucleus, and nucleus has got different parts. Okay, another fetal nucleus എന്ന് പറഞ്ഞൊരു part ഉണ്ട്. ഇവിടെ the fetal nucleus is getting the opacity. Okay, so അതിനെയാണ് ഞാൻ sutural cataract എന്ന് വിളിക്കുക. Okay, and then total congenital cataract means, ഇവിടെ total congenital cataract means the entire lens has become opaque. The entire lens has become opaque, not just a part or a layer. So that is called as a total congenital cataract. The whole lens will look white. Fine. So I'll be taking senile cataract. See, that's very important. So let's talk with congenital cataract in this session. Congenital cataract in average ചോദിക്കുന്ന 2 MCQs ആണ്. Most common type of congenital cataract, your answer should be blue dot cataract. Okay, and remember the next question they ask you is, what is the most common congenital cataract associated with decreased vision? Then your answer becomes zonular അല്ലെങ്കിൽ lamellar cataract. Understood, guys? So these are the questions, and this has come as an image based question. You can see these small dots here. Okay, this is what? Blue dot cataract. Okay, blue. Don't forget this blue here. So that is it. That's a question they ask from here. Senile cataract we'll be talking in next section. Take care. Eat well. Stay blessed. Bye-bye.